Okay, so we're gonna do the lecture. This time I've was able to download and find the PowerPoints that actually go with the textbook, which is really great. I found them to be extremely helpful just because they go hand in hand, as well as on top of that, when we do our tests that we do, our quizzes, and then I give you maybe some extra information. And unfortunately, I'm so sorry, I did have something very important to do on Monday morning, so we couldn't have that kind of discussion and other questions, but I am going to make a discussion forum with this lecture so that we do have that opportunity in order to do that. So excuse me, and please excuse me, I have multiple little ulcers in my mouth, so it's a little bit hard for me to talk. So if it's hard to understand me, I apologize. And I've been talking all day because we've been doing checkoffs in the lab. So, okay, let's go ahead and just start with the generalized, kind of where we left off, which was with our immune system, which is obviously extremely important. And we're combining that with the hematological and the lymphatic system. And lymphatic system, we talked about a little bit in regards to the immune system because they go hand in hand. And in general, at first it didn't really make sense to me. I didn't understand why are these things together, and now it does make sense, and hopefully it will make sense to you why we or why whoever put these chapters together put them together. So let's just kind of get started here and go through the slides and basic just learning objectives. And this is from the book. We're gonna of course talk about blood and the components of blood I think are really important. We talk a lot about white blood cells, I feel like, and a lot about red blood cells. There are certain things that we talk about, but I also want to really talk about plasma. What is plasma? Because I feel like in general we don't talk enough about it, and even right now in this moment, if someone were to ask you what is plasma, I wonder would you be able to answer the question, and not because you were not equipped, but were you really? I don't feel like it's talked about enough, so I do want to talk about that because it is an important blood component. So I do want to hone in a little bit on that. Of course, we're going to talk about different diseases that come up in these systems, and that's why I had the two assignments that go with this, because I knew I wasn't going I didn't know I wasn't for sure going to be able to not do the lecture, but just in case, I wanted to make sure that I had that so that you could hopefully get a lot of information in. I also want to be able to describe what happens when things go haywire, unfortunately, and different disease processes, as well as the blood clotting factors and the sequence. I actually cut and pasted that for you as well. And not that I don't think it's important, but I don't really feel like I need to go through it exactly, just because it's in writing and pretty not, easy to understand, because it's a cascade. I mean, this happens and this happens and this happens and whatnot. So I did put that under where you are able to find this PowerPoint. I copied and pasted that, something that was sent to me from Miss Ann. As far as the different lab values and whatnot, as far as the learning outcomes, those are just things that are memorized. And fortunately, in our systems nowadays, they have the normal and the levels that come out that are not normal, and they'll highlight them red or whatnot, or do some sort of flagging, of course, for your NCLEX and for the potential tests. And I'll of course put that in the study guide if I want you to know certain numbers and for whatnot. You will need to know that for the NCLEX. I'm not going to hone in on it so much for this, only because it's more memorization than anything, so that doesn't make sense to do. However, if there are some diagnoses that go along with them, of course I will mention them. And then of course, nursing care and planning certain nursing care, and what we would want to do for patients that are diagnosed with certain diagnoses that go along with these two different systems here. So only other thing I really wanted to say, I didn't want to go through all, I mean, there's a time, I mean, we're not going to go through each of these in detail. Otherwise, this would be like a 5-hour lecture, but I'm definitely going to hit on some of these specifics. And of course, they're in the book as well. But the other thing would be therapeutic measures. If there was something to go on with a patient, of course, what would we do for somebody if they had lymphoma, or, you know, I did put some videos up for you guys to watch as well. Hopefully you did watch them. I thought that they were pretty good in kind of showing some disorders of these different parts of the body, blood diseases, as well as the lymphatic system. Okay, so starting just with the general review of anatomy and physiology, the heme system, I call it heme just for short. So the heme system, it comprises of two main parts of the body, and that has to do with your bone marrow, which is inside of the bone, of course, and blood and blood components. And what are blood components exactly? So, I mean, and it's in your book as well, but I mean, in general, this system, the heme system in itself, is bone marrow, blood, and blood components. And what are blood components? Blood components would be like white blood cells, red blood cells, the plasma, and then we can go into more detail as we continue. And then the anatomy and physiology of the lymphatic system would have to do with the lymph nodes, which we had already talked about. The lymph system, not that it's not important. We're not going to talk about it as much as the physiology part because we did already do that, but I do want to, of course, I think reiteration is good. Lymph nodes are wonderful. They're all over your body. Some are palpable and you can feel them, like the ones in your neck, and the groin area, and under the armpit. You can feel your lymph nodes if they're swollen and if your body's trying to fight something. So, and keeping in mind that they're basically like little, I think we watched this video in class, I'm pretty sure, where he talked about how our lymph nodes are basically little, kind of like little airports, if you will, where when you're going through the airport and they're checking through all of your stuff and they're saying, okay, is this okay to go through? Is this okay to go through? And then they find something that is not. And then, oh, that body-wise, that could be something that could harm you or make you sick. And then our lymphatic vessels, just in general, that would be more anatomy and physiology, which we talked a little bit about them running parallel with our lymph system and how they kind of go together. It's not just two systems running separate. They run in synchrony. Okay, so let's just start with the blood in general. So blood consists of, as I had said earlier, plasma, red blood cells, white blood cells, I'm sorry, I forgot to say platelets and platelets. Platelets, we know, have the cascade where it's going to help us not to be able to bleed out. Unfortunately, and for example, just to say, this is where we would think of something as a nurse consideration. So if we have a patient who is on medication, let's say they're on, Coumadin or whatever medication that they're on, and their platelets are not going to be functioning as they normally would, what type of patient teaching we want to do, and understanding that function, that's what's really important, is making those connections of, hey, I should probably warn them. They should try to avoid, rough sports and all of these types of things. We know our white blood cells, we've been talking about that this is most of this time, which has to do with immunity. Red blood cells do many things, but I think that we mainly know them for their oxygenation, because they have a lot to do with our system of, sorry, just drew a blank there. They have a lot to do with iron, as well as many different functions. And then plasma. And plasma is the one, like I said, I feel like we don't really talk enough about. And plasma is kind of like that. It's kind of like that. How I think of it is it's like that liquid in the middle, if you will. I think there's a picture in your book. I'm kind of looking here on page 484, which kind of shows it. And really about 90 to 95% of your plasma is basically water, which is I personally find pretty interesting. And sorry, I paused there because I was going to go into a tangent about the liver, and I don't want to make this about psych and addiction. But I, what is really important, at least for me, and I think that's something that you should kind of, store somewhere in the back of your head here, is that plasma, the plasma proteins specifically, they are having a lot of connection with the liver. So your liver is, and I talk about this a lot if you've ever listened to any of my lectures on addiction. Your clotting factors are basically synthesized in your liver. So for, if you have ever taken note or heard of or been in my lecture or any lecture, or have any experience in your family where there is somebody who consumes too much alcohol, or they're not able to clot properly, unfortunately, because if your liver is not working optimally, it's not able to keep up with the clotting factors. Therefore, a lot of bruising is going to happen, and more easily. So if somebody that didn't have issues with their liver, maybe knocked their arm, they might get like a tiny little bruise or something, or maybe nothing. But if somebody that did not have a properly functioning liver, where your clotting factors are synthesized and where they are, kept and produced and all of that, unfortunately, a much bigger bruise might appear, or a bruise in general will occur, because their clotting factors are not able to keep up. So that's something to kind of keep in mind as something that is important. So something very specific that I want to say about plasma has to do with, I know you've all probably heard the terms of, especially at this point, we have different clotting factors, of course, and, PT, PTT. So prothrombin and fibrogen, they are those two things that they're basically they circulate until activated for coagulation, and basically so bleeding stops, right? But albumin, I mean, and these are just all different kind of terms that, again, you've heard of, I'm sure you have an idea of, and you're reading about it, you're doing worksheets on it, you're getting more information in regards to it. But albumin help, and you'll actually read this almost verbatim in your textbook, that albumin helps maintain your blood volume. So basically, and this is actually one of my loves, so I'm really trying not to just talk about albumin. But albumin, again, it has a lot to do with addiction, because what happens is your liver is responsible for maintaining your albumin level. So that's one of those things that they might draw if they drew it and they notice that you have low albumin, that could be an indication that you may have liver issues. That's just one. And the reason I'm giving this example is for this. So for those that have, let's say, edema, for example, and we know that when we have edema, unfortunately, our circulatory system and our different compartments, our vascular system is not functioning properly, which is what we're talking about, and things start leaking into other places where they're not supposed to go. And that's one of albumin's jobs. It's a very large protein that keeps basically your vascular system in check. I guess that would be kind of the nicest way to say it. So it keeps your vascular system in check, and it keeps things where they're supposed to be, so that you don't get edema. And that's actually, just as a side note, to kind of, if this helps link it, is because albumin is one of those things. And again, I try to speak to what I see in the hospital the most, not just for addiction, I'm just saying in general as a nurse, even though, I mainly work in psych and this and that, I work with med-surg patients all the time. I mean, it overlaps so much. So, ascites, for example, that is a condition where somebody has a very low albumin. They have a liver that is functioning at a very low level, perhaps cirrhotic and not working. I mean, barely working. And it's where somebody is collecting a lot of fluid in the belly. It's basically edema in the belly, but that is your largest body cavity is your abdomen. So you will collect fluid there, and that's when you have very low albumin, your edema is happening, all of this stuff is going on, and that's because your albumin's low, and that has to do with your blood components. So that's just kind of an example of why albumin is so important and why it is something that we need in the body, because it keeps, again, it's a large protein. It keeps basically different parts of your blood, your plasma, your platelets. It keeps everything where it's supposed to be so that it doesn't get pushed into compartments where it's not supposed to be. And of course, as just where we are in third semester, I know that you all can recognize the importance of that. Okay. Oh, oops, my apologies. Functions include, so here, transporting substances, regulating body temperature, pH, and fluid balance, transporting cells that offer the body protection. We've talked about all of that before. This is actually the picture that I was talking about that is on, I don't know what the page is on now because my dog is laying on my book, but components of blood. I think this is a fabulous picture. And if you see, I mean, a lot of that is plasma. So, and it's this clear liquid at the top where it's an extracellular matrix of liquid connective tissue, which is about 55% of the blood. That's a lot of it. I mean, if you really think about it. So it to me, I kind of think of it as it really helps to circulate things. It keeps things moving. And then there's different elements in the blood, and you can take a look at the different elements on this slide. I don't think anything is too, I'm just kind of looking to see if there's anything that pops out at me that really is, nope, all of this is familiar. And I really love these because they give like these cool pictures. And again, now, okay, so here, blood cell formation. I do not expect you to, like, we've talked about certain ones. I do not expect you to memorize every single thing on here. What is important? Where's blood formed? Where do you find this? Where do you find that? It's in bone marrow. Where's the bone? Those are the type of things I want you to be able to understand. I want you to understand, immunity, how it works. And when we talked about HIV, like what is involved in that and how is it transmitted, and all of those big, pretty much those big topics that are going to really, unless you plan on becoming like a scientist or whatnot, obviously, but that's not what we're here for. So I think this is a nice picture of different types of white blood cells, red blood cells, and platelets. So just to kind of point out a few things under like white blood cells, I do like this because we get to actually see like the basophil and neutrophils and lymphocytes and all of that. And which we didn't, they're in the book as well, but I like that we get to see them kind of all together and like the difference in what they look like and whatnot. So moving along. Okay, so this I find absolutely fascinating, again, because it does have a little bit to do with what I do. So the breakdown of red blood cells. So red blood cells do have a lifespan. As you can see, there's a liver at the top left. So of course, I'm excited because that liver is my second favorite organ. And the liver has a lot to do with this. When your red blood cells say, okay, it's time, I'm going to die, and more will of course come in its place, your liver has a large part in that process. So basically, as you can read along with me, your macrophages in the liver and spleen ingest and destroy the old RBCs. Okay, so they take them on and then they leave the body. Well, I guess I'll read this through. Usually just say the ending, but in the process, the hemoglobin is broken down into different components of, things are broken apart. We have heme, and as we know, RBCs have multiple different parts to them. And then as we go through the sequence, basically at the very, very end, bilirubin is excreted into the intestines as part of bile. And at the very end, they end up leaving the body, obviously, usually via feces. But if you look from beginning to end, so you have the liver in the beginning, right? And then you have the bilirubin at the end. So people will ask, let's say somebody, I know we can use a baby, but I'm going to use I don't get to use mine very much. So I'm going to use my specialty of addiction. And if you have somebody that is jaundice and people will ask them, well, why is the patient yellow? And what happens is when your red blood cells die, they actually, if your liver is not able to get rid of them, they get stored and they get backed up. And it's basically dead red blood cells will turn into bilirubin, as you can see here. And that bilirubin goes throughout the body and has a yellow tint to it and will turn mucous membranes and skin yellow. Just that's kind of, again, it's a side note. You don't need to remember it. It's not something that's going to be on a test. It's just kind of fun information, at least for me. Okay, so we move from here to this part, the breakdown of the red blood cell. And I think that hopefully the example helped a little bit, but red blood cells they don't live forever. I believe it's 90 days and 3 months. And then they go and they recycle. Okay. Which is also why, as a side note, why when babies are born, if their liver is not fully functional yet, maybe just a little bit, even if they're not premature, they might be jaundice, and then they put them under that light, and it can help break down the bilirubin in order to help that. So the formation of a blood clot, like I said, I already kind of posted the cascade. It's basically that's what it is. And again, I don't think it's important for memorization purposes, like for anatomy and physiology. Yeah. But for the real life, like, okay, we know. So what is important as a nurse? What is important for me as a nurse to know that if my patient is on a blood thinner or takes aspirin every day and I'm about to give them an injection or this or that or whatever, that's important for me to know. Do I need to know every single piece of why what's going to happen next? No. Do I need to know that there is a cascade and there is a part of like your body that has functions? Of course. So, because obviously we're talking about it, I mean, we're going to go through it, but I don't think it would personally, unless this was your area, I don't really, and you have to explain it to patients and whatnot and break it down into layman's terms. But basically what happens is, and I think you guys have gone through this before, but I just kind of I love this picture. So here in these pathways, we have I don't want to just read directly from the slides. I'm trying to think how I can explain this as I'm kind of more looking over here. Sorry, my dogs are fighting. One moment. My apologies. Okay, so over here, we can kind of see I like this part right here because it gives you the bigger picture rather than this, all these little tiny things. Of course, you're going to read them through your textbook, but we have when a cut happens or some sort of injury, your body responds to it, right? Because we want homeostasis. So we have a prothrombin activator that's going to basically activate the system of the cascade. And then prothrombin is going to be activated and is going to, we could get into all the factors or whatnot. It's factor 2 and it's called prothrombin. And that is going to, and then from prothrombin, we go into thrombin, which is basically when we convert the enzyme of prothrombin into thrombin, and then we go to fibrin. And that is where you get that kind of like that sticky part of when we're getting platelets coming through, and that's more of like a, how do you want to say it? Like a blood clot can happen from that. And that's the cascade. So if it's inside the body and your body is feeling like it needs to fix something, and I think I've talked about this in SIM. So think about it in terms of this way. In the body, so if your vascular system is not working to optimal level and you have high blood pressure, for example, your body can see that as a problem if one of your vessels is, let's say it's floppy, if you will, because it's not taut, because you're having such high blood pressure going through it. Your body will actually try to fix it, and this is one of the cascades that can happen. And prothrombin will be activated, then or the activator, then prothrombin, then thrombin, and then fibrin, and that's actually what creates a blood clot. So we talk about, high cholesterol, this, that, the other, but this is the main reason why people will have blood clots, is because your body is actually trying to help, but unfortunately it will actually hinder. And you can actually read that. I think it says it right here. The sticky fibrin threads form a web at the site of the injury, because your body thinks it's injured, right? So blood cells and platelets flowing through the web become, that's a word I've never seen, but anyway, it creates a clot of fibrin, blood clots, and platelets. A blood clot can effectively break in a smaller vessel. However, clotting alone may not stop a hemorrhage from a large blood clot vessel. So yeah, it's a very interesting cascade. It can be good, it can be bad. That was kind of my whole point of it. It can be, obviously, if you cut your arm, you want clotting to happen inside of the body all the time. It's not always a positive thing. And if you were not in my sim, then you did not learn that, because I did talk about that at one point. So the lymphatic system, which is fascinating to me anyway, it consists of lymph nodes, which we've talked about, and nodules. And like I said, you can feel some of your own or your patients that are palpable. The lymph vessels, your spleen, and your thymus. So spleen in general, I think, again, is one of those things where people, there's kind of, I don't know if you want to call it a myth or what you want to call it, but people say, oh, you don't need your spleen, you can live without your spleen. I'm not a doctor. I'm not going to say what you can and cannot live without, but your spleen is actually very important, and it's very important to your immunity, because as we've talked about before, your lymphatic system is important to your immunity. So your spleen is, if you didn't know this, it's in your upper left quadrant of your abdominal cavity, as well as your stomach, just below where your diaphragm is. So it's a little bit lower than the stomach, and I think you guys know where your diaphragm is, and then it's behind the stomach. So the spleen, I think you guys did this on your worksheet, but the spleen, it really does have several functions, and I don't think it's given enough credit in general as one of our organs. I think it's very important, and I want to just mention a few things that and I think you already read this, but it has a lot to do with your B cells and your T cells. So we know that our B cells and our T cells are important, right? So that would make the spleen important, because B and T cells have a lot to do with your immunity. And as we mentioned before, they will have a lot to do with your immune response, and they have a lot also to do with being able to contain your macrophages and the phagocytes and pathogens, and being able to know what to do, and as well as, I mean, I could go on and on and on and on and on, but the main thing that I really wanted to make the point of is that they are a big part of your immune system. So again, what do we want to remember? Your spleen is important. Your spleen, you can live without your spleen, yes, technically, but it can come with a lot of compromises, right? Because if it has so much to do with your immune system, and that's what I want you to take away from that part. The second thing has to do with your thymus, which, as I'm so sorry that the last time that I did the video, or I did something, I kept saying thalamus. I have no idea why. But your thymus, which is one of your glands, which I feel most of you have either felt or have talked about before, which also has a lot to do with your immune system. And that one is where we had talked about before, where your T cells go from your bone marrow and then they go to your thymus to mature and then be able to kind of what's that word? Whatever, go leave there and then go throughout the body to do what it needs to do. So I think that those would be the two takeaways from that, why the spleen is important and the thymus. They have a lot to do with the immune system. So functions on this slide say returning tissue fluid to maintain, this is lymphatic system, by the way. It returns fluid to maintain blood volume. It absolutely does. There is a lot of blood volume and fluid volume in general in the lymphatic system that works, like I have said before, parallel with your vascular system, and it protects the body against pathogens and other foreign material, which we talked about, kind of like the airport and it, things going through it. So we already did this in the book, so I'm not going to go through this. You already went through kind of, what nodes and whatnot, but here's another picture. The aging, yeah, I mean, of course, we already know this, right? I'll briefly review it. Of course, aging does change the body and it puts us at more risk for decreased immune response, potential iron deficiency from lack of appetite or not getting in proper nutrition. You may not be able to make red blood cells quick enough, which can also cause anemia, which would be iron deficiency. And this would all, unfortunately, be at risk for anemia, increased risk for dehydration, increased risk for infection. So those are all things that we would want to consider. And again, we walk into our job, right? Okay, so let's say you're working at a skilled nursing facility. You walk into your job, you know all of this stuff. You know some of the pathophys, you got it down, whatnot. But what are you going to do about it? And what are we going to do with it? So if I know this, I know that the importance of making sure that my patient's getting a nutritious diet or doing my best to make sure that they're getting what they need, because I don't want my patient to get an infection. And what am I going to do this or to do that? And this is why we do all of what we're doing. And this is why we're teaching everything that we're teaching. It's not just about memorization so that you can get a good grade on your quiz or your test or whatever it is. So you take it and it makes sense. Why do I want my patient to eat their vegetables or whatever it is, or their protein or whatnot? Because I want to help their wound heal. Well, I mean, obviously, it's, healthy and whatnot, but I want you to keep that in mind. It's not just memorizing it. It's what you're going to do with the information once it's in your head. Health history is always really, really important. We know genetics play a huge risk in many, many things. So we want to definitely always get a really good health history from the patient, as well as a health history of, if we can get any sort of history of a family history. Physical assessment, all of these things are going to matter. Of course, vital signs, if they're low or high, having to do with blood volume, level of consciousness, if they're orthostatic, their skin color, if they're paler than their skin should be, or kind of like a grayish color if they have dark skin color naturally. That could be anemia. We want to look for, of course, signs of bleeding, which would be like I had mentioned earlier with the bruising. We want to palpate those lymph nodes and see what's going on, do capillary refill, see how circulation is doing, look at the fingernails, see if they're brittle, are they getting what their body needs. And the abdomen, as I mentioned earlier, with the albumin, and that would also go with lab work as well. Different diagnostic tests, everything we had mentioned earlier. Blood tests, there's several different ones. Coagulation tests, PT, PTT, are two of the most common ones that we hear of. Bone marrow biopsy if needed, if a patient is going through potential symptoms of having, or if they're already diagnosed with a certain disorder or disease process, which I'm going to actually go through at the end. So this is I'm going to kind of skip a few things until we get there, and then I'll go over chapter 28. Blood products. So yeah, so these are all blood products that we can give to patients if needed, which is great. I mean, this is amazing that we can give this to patients that are not able to create or don't have enough for themselves, especially, when we talk about some of these disorders that we're about to get to. Transfusion safety tips. As a side note, what was I going to say? Sorry. Totally forgot what I was going to say. My apologies. Always making sure that when we're doing transfusions that we take every safety step for that. It's very important because obviously we want to make sure that same blood type. So we already know this. We know this. It's very similar to giving medication, but we really, really want to make sure it's for the correct patient. During the transfusion, and keep in mind, so this is what I was going to say, autologous. So if autologous, meaning I'm taking blood for myself. I'm taking blood for myself, and because I'm going to use that blood or my physician or whomever is going to use that blood to give myself a blood transfusion because I want to use my own blood. So I pre-planned for this. We're still going to watch for all of this stuff. You can have a reaction to your own blood, so keep that in mind. So I'm going to watch when someone's getting a transfusion for, do they have a fever? How are they acting? How do they look? Does it look like they're having, what's their blood pressure? What is happening? They're very, very closely monitored, and it's very, very important. And it's one of those things, not that anything medical is not important, but this is one of those things where it's kind of like, okay, we really need to pay attention to what's going on. So I want you to kind of, keep that in mind, and definitely always keep in mind, please. And this is an NCLEX, one of the NCLEX questions I got was, what was it? Had something to do with a patient who had a blood transfusion of their own blood, and they were having a reaction to it, and that can happen. Okay, so I didn't even look at this. Okay, so I'll let you guys, I want you guys can answer these on your own, because I would rather take the time to just stop sharing it and finish with the recording. So let me just exit out of here. So please take a look at those questions. Not that they're not important and I don't not want to talk about them. I just, and I don't have a background and I'm not showing my face right now. I'm not really actually feeling well. I'm having an allergic reaction to my dog right now. So my apologies. I know I don't sound well. And so in general for anemia, we're kind of moving on to the next chapter. In general for anemia, there are different types of anemia. It's important to understand that there are different types of anemia. You can all read in your books, which you should be anyhow, about anemia. But some of the things to know about anemia is it is fairly common. And there can be certain times of, people's lives where they are anemic if they're taking a vow of, maybe not eating certain foods, or they go vegetarian and they don't, and this is just what I would call like a regular anemia. It's not something that is sorry about that. For example, a woman, during her menses and whatnot, that can lead to anemia as well, just because of the amount of RBCs that are lost through that. And there could be potential dietary deficiencies, as I mentioned earlier, that could be ongoing, it could be just happening. And then, as we probably all know, signs and symptoms, just exhaustion, weakness. There are certain vitamins that can be taken. Usually, if you go into the doctor, they're going to take blood anyway, and they'll just figure it out by diagnostic test that you're anemic, and be able to give you, the proper treatment for that and let you know what you need to do. There are other types of anemia, like aplastic anemia, which has to do with that. There's different types of anemia. When we say anemia, I think we usually think of the one I just was talking about, but there are different types. With aplastic, that one is that type of anemia differs from the other types in where, so your bone marrow in general, it becomes like a, not adipose tissue, it becomes fatty and it's not able to produce red blood cells. So unfortunately, that's what that means. So aplastic anemia. So your bone marrow becomes fatty, it's not able to make the proper amount of red blood cells, and then you're not able to have enough red blood cells go throughout your body. So you're gonna again have certain signs and symptoms. You're gonna have a lot of bruising. You're not gonna feel good, and you're definitely gonna probably go to the doctor because you're gonna have such an amount of signs and symptoms from this type of aplastic anemia. And the reason being is it's a much bigger. There's a lot more signs and symptoms with this. Just a quick example, oozing from certain mucous membranes. It's not good. There's a lot of clinical things that are happening to the body. So when one goes in and is treated for this, it's something that's, very, very important. Hopefully the patient doesn't wait too long. They get in, it's identified, and we're able to identify, okay, aplastic anemia is happening, and whatever the underlying reason of why your red blood cells are not being able to be produced because of what's happening in the bone marrow can be treated, because really, I mean, you need red blood cells for survival. So if you don't have it, we need to be able to fix it. So hopefully that underlying measure can be treated. And again, that's what's important, right? Everything that I just said. There's more that you'll read in the book, which is great, but that's like the biggest point is, okay, this is what happens, this is what this means, and this is, how we can treat it or whatnot. One other one, there's different, obviously, anemias. One that we are probably also familiar with is called sickle cell anemia. And sickle cell anemia is one that I will never forget from nursing school. And that one is what we call inherited. So we get it from one of our family members, and it is where basically it's like a mutation. Your red blood cell, it doesn't function properly because it's mutated, and you're unfortunately very sensitive to oxygen exchanges. So which is obviously important, right? Because we know oxygen binds to the heme and in the red blood cells. So anytime a decrease in the oxygen tension is sensed, the cells begin to have this kind of a physical change in actually the way they even look. So you can actually see it, and this is not good. And that's what they mean by sickled cells. And when you have a sickled cell, it's very rigid. It's very easily to be broken. And the shape, since it's not normal, it also causes the cells to become tangled into the blood vessels. And the result, unfortunately, is it's clumping and clotting, and this can cause an array of amount of issues. And this is something also that's very painful. That's something for NCLEX, just as a side note. I'm going to let you read the rest of like signs and symptoms and all of that because you're fully capable. But the highlights that I'm letting you know is that your red blood cells are basically, when you have sickle cell anemia, are not shaped correctly. The oxygen is not flowing correctly, and it causes pain. So those are obviously all very important. There, of course, is a diagnostic testing for this and whatnot, and this is all in your book as well. And it, okay, good. It does. I'm making sure it talks about the pain, so that's very, very important. I posted a video about lymph. I'm trying to think what I posted videos about and what I didn't. Anything having to do with hemorrhagic? I mean, so like, for example, on page 507, table 28.2, it talks about different laboratory tests. I want you to look at it and just kind of get an idea. So if I were to say to you, if I said the word PT, and I wasn't talking about physical therapy, I was talking about blood, I want you to be able to understand that that has to do with blood clotting timing. If I said PGT, I would want you to know, I don't need you to necessarily remember it means partial, thromboplastin time. I want you to have an understanding that what these things mean and have an idea that that's what they connect to. Again, it's about connecting things together and knowing what goes with what. So I would say really other important factors to consider, now of course put this in the study guide as well, is some of the, like, thrombocytopenia, for example. I know that we've all heard of this, and this has to do with the fact of, or maybe, I'm not really sure actually if you've heard of thrombocytopenia or if you guys have talked about this, but this having to do with the increased platelet deduction, which has to do with the fact that, unfortunately, what happens is the blood clotting factors are destroyed and you're not able to clot as you once were. So obviously that's not good, and we don't want that. And I mean, there's all these different disorders and what's important, what's not. I mean, having an idea of kind of like, oh, okay, thrombocytopenia, that's probably important to know, because thrombo, or just understanding and kind of like being able to visualize those words. Leukemia, that was another video I put up, so I'm not going to talk about it, but it's basically having to do with the white blood cells and cancer. It's a very unfortunate diagnoses, and then multiple myeloma. I'm not going to talk about because you have an assignment on that where you read. I have you doing something about that. And then I also posted a video on Hodgkin's disorder and disease, both types. So I'm not going to talk about those either, because I did that. So we did talk about the spleen. That would probably be one of the last things on here. And just to kind of back up what I said right here, it says that the spleen it can be surgically removed. It's not ideal, obviously, because what's going to happen, for your life? I mean, you're going to struggle with what we just talked about. Has a lot to do with your immunity. You're going to struggle with, not getting sick. So that is the whole point of, I'm going to kind of make a wraparound here. And that is the whole connection of, okay, that makes sense. If that has so much to do with my immunity and they take that out of me and I know I can live without it, what am I potentially going to struggle with? My immunity. So this is kind of where we're leading to. So, okay, so I think that, in my opinion, thus far, this is probably a chapter that I think explains things very, very, very well. And again, I want you just to hit the highlights. I'm really sorry we didn't get to have the full class discussion. Starting with the next system, which will be the endocrine system, I'm going to start doing things a little bit different. And just because, again, we're kind of all evolving as we go. And I'm going to, you'll see as we go, it's going to be a little bit different as far as the lectures and how we do everything, and as an improvement, just because I kind of found some new ways to incorporate things that I had things that I didn't know that I had I was able to use as far as lesson plans to kind of help as well. So anyhow, let me know if you have any questions. I'm going to make the discussion board right now. And again, I will, of course, don't worry for your test. You will have the study guide, so you'll know, then be able to go back over to get that reiteration and replication of, like, you know, information of what's important. And I hope you all have a good night. And it was great seeing those of you who I got to see today. It's wonderful. Thank you so much.